So today I'm going to give a brief overview of midwifery advanced practice and then talk a little about the NMC advanced practice regulation review. And whilst this review is looking at nurses and midwives, my discussion today will be focused on the midwifery aspect. However, I am very happy to take questions about the nursing review at a later date if anyone would like to do so. So in England, it's estimated that we have somewhere in the region of 70 to 90 midwifery advanced practitioners. The area of maternity in which they work has been largely responsive to the service need in that particular trust. So some examples are Triage DAU, as most of us are here to talk about today, enhanced maternal care, maternal medicine, community hubs, postnatal services, perinatal mental health, perineal and pelvic health. So as I say, these examples of service improvement have come as a result of audits and surveys. So the success of these roles does largely depend on organisational support. And where I've seen the roles really thriving are when there's been clear governance, scope of practice has been outlined, as well as continued support from managers and supervisors. So one of the biggest questions I get asked is how advanced practitioners differ from specialist or enhanced midwives, and also from consultant midwives. And whilst there are many similarities, there are also some key differences. So on this slide is a very basic example of how they might differ. So with a specialist or enhanced midwife, it's generally a senior midwife with a particular area of interest. They may or may not have underpinning academic level 7 study. They might work across some of the 4 pillars of advanced practice, but not usually across all 4. So, for instance, an infant feeding midwife might have specialist skills and knowledge on infant feeding. They might provide some training and education on feeding and also work within that clinical pillar. Some might also have some of the leadership pillar. However, generally, as I say, it doesn't cover the 4 pillars. Whereas with advanced practice, as I'm sure most of you are aware, they have underpinning academic knowledge at level 7 and work across the 4 pillars. So working at advanced level, they might have a particular area of interest or speciality, but they're usually a bit more generalist versus specialist. However, advanced practice is seen as a level of practice and not just one speciality or defined skills, although they might have enhanced skills and knowledge within one area, but they should be covering all 4 pillars of advanced practice. Although, again, important to note that the weighting of which they work across each of these 4 pillars might vary. And then going on to consultant midwife. So that's generally working across the 5 pillars. So you've got the 4 pillars as per the advanced practice framework, and then that 5th pillar of consultancy. So what I see generally is that consultant midwife works less clinical time and slightly more strategic versus an advanced practitioner. They could lead developments, quality improvement projects, and generally should have completed a master's and either completed or potentially be working towards a PhD, although this is not mandatory.
Excuse me, Romie, sorry, we're still seeing slide 2.
Okay, right.
You perhaps need to click on the slide icons on the left-hand side to show the appropriate slide.
Sorry, mine is just coming up as the main view, so bear with me.
We're still actually seeing your main. That's it. Yeah, that's it.
Okay.
So if you click on the appropriate slide there at the left-hand side, we will see the right one.
Okay, that's fine.
Right.
So is the view okay now, Derry?
Yes, we're on slide number 5 right now.
Lovely, that's great. So
okay.
Advanced practice in midwifery is a relatively new concept, as I'm sure most of you are aware. And still today, we've got many units without advanced practitioners, or for some people that I speak with, they're not even aware that advanced practice exists within midwifery. However, we have come a long way over the last 7 years, and we're seeing advanced practice trainee numbers increasing year on year. So here's a bit of a visual summary. I'm not going to go through all of this, but just showing the journey that advanced practice and midwifery has been on. And then now currently, which is what I'm going to talk about following this slide, the NMC in 2023 have committed, following commissioning of independent research, to a review of advanced practice, and that includes nursing and midwifery. So moving on to the NMC review. So a bit of a background on this review. As I mentioned previously, the NMC commissioned independent research resulted in the publication of the Nuffield Trust report, which some of you may or may not have seen. And then in 23, the NMC Council have agreed to the recruitment of additional resources, and they went to the 4-nation chief midwifery officers and chief nursing officers to nominate both a nurse and a midwife from each of the 4 nations to represent their country on the review. So following that, I've now commenced my role as the midwifery advisor for England. So the Nuffield Trust report highlighted some key potential risks to public safety. So they talked about that protection of the public, so the latent risks that are associated with some of the activities undertaken by advanced practitioners. So the diagnosis and intervention. There was highlighted that there's a lack of clarity and scope of practice, a limited understanding of the role by the public, and huge variations in the education requirements, the employer requirements, and also the roles and extent of practice across sectors, both within the healthcare setting and social care setting. So when the review had commenced last year, there was a steering group that was developed, vast engagement with various stakeholders. And following all of this engagement, 6 potential regulatory options were proposed. So we've got here maintaining the status quo. So we do nothing, we stay as we are at the moment. The second option was to use existing mechanisms that are in place. So go through revalidation or put in place a preceptorship. There was joint approaches, so that's working with, say, the RCN, RCM, and other regulators as well. The option 4 was to have a test of competence for advanced practitioners, and option 5 was credentialing, so that's either via the NMC or through other organisations, again such as the RCN and RCM. And then option 6 was full-scale regulation. So these options were taken to the steering group, and after this it was decided that to provide full public protection and standardisation of roles, that full-scale regulation was required. So, as I say, the evidence was reviewed by the steering group. There was an options appraisal, independent analysis of all of our engagements. There was a huge amount of work that went into this. And there was that recognition, having reviewed all of that evidence, that full regulation was required. So then the next stage, we looked at what needs to happen next. So that is developing standards of proficiency, programme standards for higher education institutes, looking at a collaborative approach. So this is a 4-nation piece of work. So in England, we're a little bit further forward than some of the other nations, but this needs to be UK-wide because that's where the NMC covers. Part of this also is to develop a shared definition of advanced practice, which is something we don't have agreement on across the 4 nations as it stands. And also make sure that any work that we do on advanced practice is included within the revalidation review that's scheduled for 2025 and 2026. So it's important to note at this point that advanced practice is a level of practice. It's not a job title or a role. And it's going to be advanced level practice that's regulated and not advanced practitioners as such. So as you can see here, the first thing is looking at, so for existing practitioners, it's going to be looking at their existing skills and their experience. They will need to identify areas for development or confirm that actually looking at the competencies that are developed, that, yep, absolutely, I meet all of those. And then they'll need to go through the transitional approach. So the transitional approach could apply to midwives in a variety of roles. So specialist midwives, advanced practitioners, and potentially consultant midwives may choose to get themselves recognised as an advanced practitioner. there'll be an annotation on the NMC register, so where we're annotated as midwives, and some people have got the additional in the prescribing that's as an annotation, then that will also include advanced practitioner. So as I say, they would need to demonstrate the 4 pillars of advanced practice and then go through that transitional approach. So I'm currently working on that transitional work stream. We're looking at the various options as to how this is going to work. And as part of this, we're looking at
Can't hear you, Romie. Sorry, you just came back.
Oh, okay. And also the RCN and NHS England Centre for Advancing Practice also do a credentialing process which recognises current advanced practitioners, and they get a digital badge. So as I say, this is a massive piece of work. There's lots of work going into it to set the education standards. So when somebody goes through an advanced practice program, that program should have been signed off as approved by the NMC. And also those competencies. So for an advanced practitioner, you'll look through those competencies and will need to meet all of those as part of your training. This particular section where I'm talking about transitional approach will apply to those that are already working at an advanced level or feel that they're working at an advanced level at that time. So in terms of further updates, the timescales we're looking at this time next year to hopefully be in a position whereby we can share the competencies and share how this is going to look. So as I say, lots and lots of work in the meantime. We're also going to be doing lots of stakeholder engagement. So there's a huge opportunity if anyone's interested in getting involved in this. I'm very happy for my email address to be shared, and you can contact me directly. So thank you very much. And if anyone, as I say, any questions at all, you can pop those into the Q&A and we will be answering those throughout the day. But thank you very much for having me. I appreciate the time to talk, and I will now hand back over to the next speaker.
Thank you, Romie. Are you still there, Romie?
Yes, I am. Yeah.
Okay. Yeah, so we haven't had any questions come. Oh, yeah, there's just one that's just popped up. She said, someone says, please, can we see the pillars again? I don't know if it's easy for you to share your screen again.
Yeah,
Otherwise, I can say the 4 pillars of advanced practice is clinical, leadership and management, education, and research.
Yeah, and as I said previously, the amount of time that an advanced practitioner spends working within each of those areas are going to very much depend on their role and also how the trust is using that role. So it may be that clinical time, so for instance, an advanced practitioner working within the triage setting, it may be that they spend a lot more time working clinically than what they do on the leadership or research, but there should always be coverage within each of those 4 pillars. Hopefully that helps.
Yep. And so then there's one more. It says, so will the NMC just be regulating nurses and midwives who work as advanced clinical practitioners, or will it also encompass AHPs? Okay,
so that's a really good question. So within this review, being the NMC is just a regulator of nurses and midwives, this review is just focused on nurses and midwives. However, there's been a huge consideration for the group of AHPs because what we don't want to happen is for there to be huge differences and for AHPs to feel undervalued. So we're very much working with the regulators of AHPs, and they're included within all of the engagement. However, the direction of travel, whether they decide to go on and regulate, is obviously something that's outside of our control within the NMC, but they're very much watching the progress of this review and considering it going forward.
Perfect. I think it's such an exciting time to be a part of it. And it's always exciting to be there at the start of something and see it grow. If there are people if there are people that are watching that maybe feel like they're working at that level, or are interested in going forth and having the advanced clinical practitioner training, do you have any kind of general generic advice for people of how to maybe speak to their managers or speak to the trusts about getting funding or starting on the pathway or looking at developing the roles within their trusts?
Yeah, absolutely. I would recommend, obviously, first of all, researching the role. Attending things like this is great because it's going to give you a real insight to how the role of an advanced practitioner works. But then, yeah, approach your employer, see whether they feel there's a particular service need, or actually, if yourself you think, well, there's a bit of a gap there, I think an advanced practitioner could work really well, then you could approach your employer and have those conversations. In England, there is some funding attached to training as an advanced practitioner, but that would be something that I would recommend you contact your regional faculty in the Centre for Advancing Practice, NHS England. That's assuming that everyone here is from England. For any of those that are outside of England, please let me know, because slightly different funding models at the moment. But yeah, I would say put together a case and take that to your employer. I think also it's important for me to say that it might be a little bit unsettling for those that are currently working at an advanced practice level with all of this change going on. People are probably thinking, gosh, is this going to create lots of extra work and we're going to have to jump through lots of hoops? And that's really something that we're considering. We want it to be a proportionate approach. We don't want to be creating lots of extra work and making people have to, develop and create lots of paperwork. So the aim of this process with the transitional is to make it as straightforward as possible, but whilst making sure that we are creating that baseline level and a bit more standardization across the roles.
Right, and then there's a question here. As AHPs already have an accreditation process through NHS England, will this not create potential duplication?
Yes, so as I say with the AHPs, it's a slightly different group. For nurses and midwives in England at the moment, you can go through the Centre for Advancing Practice within NHS England. As I say, they do kind of like a digital badge process where you've got that recognition that you've gone through that training. However, with the NMC, this is, as I said before, a four-nation approach. So we're very much trying to get that standardisation across Northern Ireland, Scotland, England and Wales, which is something that we don't have at the moment. So I suppose that's where the differences are. We are quite far ahead in England at the moment. So, but we're looking at what's done in England as well at the moment, and very much working in collaboration with the Centre for Advancing Practice, because they've done some fantastic work, and we absolutely want that to be recognised within this review.
Perfect, thank you. I think that's it for questions.